In the late 90s, a lot of people were on hormone replacement therapies, and they were seeing benefits. They actually were all these observational studies that showed, wow, the heart disease is less. And
During
this is
menopause.
during menopause. And $1 billion went into the NIH to study this in women. And it was called the Women's Health Initiative. It was thousands and thousands of people aged 50 to 79. They gave a hormone pill, like a birth control pill almost, to all of these women, and they followed them. And they stopped the study early in the early 2000s, and they did a press conference. And at this press conference, they said, we're shutting down the study early. Hormone therapy causes cardiovascular disease and breast cancer. And overnight, a multi-billion-dollar industry went to nothing. Everyone was told, throw your hormones in the garbage. This is dangerous. What was crazy is those people who were prescribing hormone therapy were looking around saying, I don't understand. My patients aren't dying of heart disease. They're not getting extra breast cancers. This doesn't make any sense. And when people actually looked at the study, it didn't say any of those things. It was wild how misinterpreted this study was. In fact, the same authors of this study back in the early 2000s published this year in 2025, actually, that below age 70, that type of hormone therapy, which we don't really use anymore, has no increased risk of cardiovascular disease or stroke. And yet now you have a generation of doctors who weren't taught how to do this.